Welcome to the outdoor Park RX breakout session of the Rural Health Conference. We appreciate you taking time to get on the session today. I'm Sarah Hodson. I'm the Executive Director of Get Healthy Utah, and we're proud to be a sponsor of the summit, and I'm really excited to be a part of this, I'm assuming, first digital experience of the Rural Health Summit. And hopefully we can have a really great session here today. I want to thank all of the sponsors. You can see their logos up on the screen. And we also want to just acknowledge all of the work that the public health professionals and providers are doing during this COVID-19 outbreak and working to keep communities safe. In order to obtain CME, if you're interested, there's some information at the bottom of the slide, an email address that you would need to send information to. So please take a look at that if you're interested in CME. And then we invite you throughout the session today to use the chat feature to share maybe what you're doing in your community related to outdoor recreation, physical activity, or if you have a thought of something that you're inspired to do as a result of this session, please share that through the chat function. You'll also see at the bottom there's a Q&A function, and that's where we want you to put any questions that you have, and at the end of this session we'll go through those questions and hopefully get to answer all of those for you today. Just for your information, the webinar is being recorded and the slides should be made available to you. So I'm going to start by just providing a brief introduction of our panelists and the topic, and then each of them will be able to go through their slides as well. Okay, so again, I'm Sarah Hodson with Get Healthy Utah, and I'll be providing just a brief introduction when we start. We also have Sarah Kinnison. Sarah's from the Salt Lake County Health Department. So a little brief intro on Sarah. Sarah has a bachelor's degree in health science with an emphasis in public health from Brigham Young University, Idaho, and currently she's working on a master's in public health from Utah State University. Sarah, in her position at the Salt Lake County Health Department, focuses primarily on diabetes management implementation, working with clinics to, on quality improvement projects and promoting physical activity through the Park Prescription Program. We also have Dr. Jesse Spencer from Intermountain Healthcare, and he's going to talk specifically about the Walk with a Doc program. Dr. Spencer is a proud rural family physician living and practicing in Richfield, Utah. And in addition to full spectrum family medicine, he serves as the regional medical director for Intermountain Healthcare Medical Group, as well as for Intermountain's telehealth program. And I know that both Sarah and Dr. Spencer have been really busy over the past few weeks with COVID-19 responsibilities, so we're especially grateful that they could take some time today to be a part of this panel and participate with us. So I want to start my just very brief background and introduction by talking a little bit about some work that we at Get Healthy Utah did with the Department of Health in 2015. And we wanted to look at what would the projected rate of adult obesity be in Utah in 2050. And so I recognize the numbers on your screen are probably too small to read, but you get a sense from the lines. The top blue line is the rate of adult obesity in the US, and the bottom solid green line is the rate of adult obesity in Utah. And then the dotted line is the projected rate, and this comes from Department of Health. And so the projection is that by 2050, 46% of Utah adults will be obese, and that's concerning. And as we looked at that number, we thought about, well, what can we do to help make some impact there, especially when there's been a lot of work over the past few decades related to adult obesity and trying to impact that rate. We did something similar for adult diabetes. You can see here again, the top blue line is the US rate of adult diabetes. The bottom green solid line is adult diabetes in Utah, and then the dotted line is the projection out to 2050. And this is a projected increase that nearly doubles by 2050 of the adults in Utah with diabetes. And again, a concern both for the medical impact, the cost impact, and the societal impact that this would have. So we started thinking about how can we better address Utahns' needs and get their perspective. And one of the things that we did was to do what's called a health values study with a group called Envision Utah and Heart and Mind Strategies. And I won't take the time today to go through the values study in full. You can find a lot of that information on our website that's listed at the bottom of the slides here, but there were a couple of findings that I thought were really important for this conversation we're having today around physical activity. And one was we asked participants, when you're not being physically active, why? What are the barriers to being physically active? And what we found was that people had a perceived barriers related to time, energy, and convenience. So they felt like they worked too many hours, they were too busy, too tired at the end of the day, too much screen time. So this is adult self-reporting, too much screen time, poor time management, that sort of thing. So those are the things they felt like were barriers to being physically active. And I think that when you learn about the two programs that Sarah and Dr. Spencer are going to talk about today, you'll see that these are programs that try to address some of these barriers of being too busy and not having enough time to get physical activity into the day. So the second finding that I thought was interesting for the work that we're talking about today was we asked participants to say what are the strategies they think would be beneficial for improving physical activity in Utah. And the first is related to schools, but the second and third are related to community objectives. One is to increase the availability of free recreational opportunities for physical activity. And then the second was to promote safe walking and biking in neighborhoods and communities. And the two programs, again, that we're talking about today really meet these criteria that Utahns seem to want, which are free and affordable recreational activities and safe places to walk. I think that's helps to promote the programs and show the beneficial nature of them. And then the final finding, I think, from our value study that's interesting for our conversation today is we asked people who is responsible for your health. And while Utahns overwhelmingly believe in personal responsibility for health and personal responsibility in general, they do see the importance of healthcare professionals in terms of their health. That's outside of themselves and their family, a healthcare professional was the most important person that they saw as influencing their health. And both of these programs have an important role for healthcare providers. So I think that's an interesting component of the types of physical activity that we're talking about today. Finally, from my introduction, just why walking? So why is walking such an important part of physical activity and improving the health of communities? And there's just so many reasons why that is, and I think the other two presenters will get into that as well. But there's just a number of physical benefits to walking related to blood sugar, blood pressure, heart disease, cancer, stroke, diabetes, all sorts of health benefits. But there's also benefits to our emotional health, to our connection with the outdoors, to our connection with the neighborhoods and places that we live. There's helps in sleeping better, in thinking better, and feeling better in general. So walking is just such an important part of a physical activity program, and an important part of having a healthy community is having places that people can feel safe walking. So I'm really excited to hear more about these programs and ways that we can better incorporate them into our communities. So we'll start with Sarah talking about ParkRx. And Sarah, you can just tell me when to advance your slides. All right, thank you.
Okay, perfect. Thank you, Sarah. Like mentioned, my name is Sarah Kinnison, and I'm a health educator with the Salt Lake County Health Department, and I'm excited to speak with you all today about the ParkRx initiative. Next. Today, I will talk about what ParkRx is, what a program like ParkRx is needed, what has been done in Utah already, the next steps in rural Utah, and action items for you to consider. Next. Instead of prescribing a patient to get more exercise, something most patients already know, what if you could prescribe something more specific? ParkRx is the prescribing of parks and other protected areas to patients in the clinical or community practice setting to promote and encourage physical activity. ParkRx is a way to connect people to the outdoors and the parks, which are available to all, and encourage Utahns to be physically active. Something to keep in mind is it doesn't just have to be a doctor or a nurse that gives a prescription. A prescriber does not need to have a medical license. So why a park prescription program? The closer we are to open space, the less we suffer from chronic conditions and the more our mental health improves. We are so fortunate to live in the state of Utah, where there is a great focus on the outdoors, as well as many local and national parks to visit. As you can see, there are many benefits to parks, not to mention other outdoor activities. They are convenient to get to, inviting and reliable, free of cost, accommodate ability level of patients, and provides opportunities for regular engagement. Park prescriptions can be, oh, one more, go back, thank you. Park prescriptions can be a free of cost, medication-free antidote to physical and mental illness, and is something all patients can participate in. Next. All right, so now that I have briefly described ParkRx, I want to show you an example of what a Park prescription could look like. Using the ParkRx America database, a doctor, nurse, case manager, etc., can become a prescriber. When prescribing a Park, you will type in the patient's address, selecting a mile radius, and select Go. A list of parks will populate, and you can discuss with the patient which park is most plausible for them, and you will then select prescribed park. Next. Next, a pop-up window will appear for you to fill out the take, frequency, and duration of the prescription for the patient, just like any other prescription you may give. This allows for it to be a specific prescription for them to complete instead of inviting them simply to get more exercise. After that is completed, the patient will designate whether they would like to receive their prescription via text or email. You will then ask for their phone number or email address to send the prescription to. The patient can opt to receive reminders to fill the prescription, and then you will send the prescription to the patient. On the patient side, they will receive the email or text with a link, and they will click on the link to access and fill the prescription by following the take, duration, and frequency you prescribed at the park that was decided. Next. Once the prescription is sent, if you are prescribing the Park in a clinical setting, you have the option to copy and paste the prescription to enter into your EHR system to make this a seamless process for clinical practices. Next. All right, now that we have a general idea of what a Park prescription is and what it can look like, what has been done in Utah? I heard about this ParkRx idea back in 2018, and it has been a slow but steady process to get something planned and implemented in Utah. In the first year, a lot of research was completed to learn about similar programs around the country and the benefits of Park prescriptions. ParkRx America, the example I gave you in the previous slides, is a nonprofit organization based in Washington, D.C. And because they already had a database, I decided to partner with them to add parks with walking paths in Salt Lake County. Over 150 parks were added, and I began to develop a program and the evaluation measures for clinics to pilot this program. We had one clinic and one worksite pilot this program in 2019. Evaluation was key in these pilot programs. I was able to receive feedback on what worked and what didn't, and made the appropriate changes to the program in Salt Lake County. But the evaluation measures taken from the patients were the most vital. Part of the ParkRx program in Utah, we want to gather clinical measures such as BMI, blood glucose for diabetes patients, but blood pressure measurements, as well as qualitative measures such as asking questions before and after patients participate in this program about their mental health and their motivation to be physically active. By having these evaluation measures, we can track if the program is effective and have this data for the future. As I continued to run with this idea and began to pilot programs, I realized I couldn't do it all on my own. I needed different perspectives to help this program grow to its full potential. In 2019, the ParkRx Utah Coalition was created. Currently, we have representation from Intermountain Healthcare, University of Utah, Get Healthy Utah, Utah Recreation and Park Association, the Governor's Office of Outdoor Recreation, and Kearns Oker Park Fitness Center. Having the perspectives and connections to different areas such as public health, research, and outdoor recreation really got this project moving. Even so, as we discussed making this ParkRx program a statewide initiative, we decided we needed to get the input and feedback from more statewide partners so we can create this ParkRx Utah program on a firm foundation. With that being said, in February of this year, we hosted a ParkRx Utah stakeholder retreat. Next. The ParkRx Utah Stakeholder Retreat was held on February 21st, where we had 70 statewide partners who attended this event. These stakeholders came from industries which spanned from Parks and Rec, public health, insurance, community leaders, nonprofits, public health, and the healthcare industry. We invited Joe Burns to speak with our attendees at this event. Joe comes from Colorado and is a key player to their Outdoor RX initiative. We were able to learn directly from her successes and barriers of what a statewide program may experience, and this allowed us to warm up the attendees' minds in time for our breakout sessions. The core of the event consisted of attendees participating in breakout sessions so we could learn from them and what they believe should be included in a statewide Park RX program. These breakout sessions consisted of topics of Foundation for the Future, Outdoors for All, Data and Reporting, Healthcare and Community Partnerships. Because of these breakout sessions, we gathered the input from different expertise and had their voices accounted for. We are currently compiling our notes to share with the public soon, and our next steps after this retreat include adding parks outside of Salt Lake County to the Park RX America database, building website, and piloting more programs throughout the state. Next. I do wish to speak on a few things which were decided from this retreat, which specifically relate to rural Utah. One of our goals with Park RX Utah is to ensure it is truly a statewide approach and to make sure we are considering how this would look in rural Utah. One of our takeaways from this retreat is that we would like to perform a needs assessment looking at rural and urban populations to understand the need to have a Park RX program in Utah. There is an assumption that rural populations get out more and have more access to the outdoors, but we want the data to speak for that. We also would like a rural voice on our Park RX Utah coalition, as only they could be a true expert on rural Utah and their needs. We also want to promote current programs with the same idea of Park RX Utah, such as the Walk with the Doc program, which is to get residents outside and get them moving. We also want to define rural Park RX opportunities. This program doesn't just have to be about giving prescriptions to local parks. We can make prescriptions to walking trails and hiking trails and other outdoor recreational activities which are unique to rural Utah areas. Next. All right, so I want to offer some action items for you to complete to further investigate this Park RX Utah initiative. You can visit the Park RX America website, learn more about the Park RX initiative and the benefits of prescribing parks. There's information about the benefits which pertain to diabetes, hypertension, and other diseases. So I invite you all to go to that website. But we do ask you to not sign up to be a prescriber just yet. We want all providers to connect with us first so we can collect certain data to track and follow. Like previously stated, we currently only have Salt Lake County parks on the database, and we're working with other parks and rec agencies around the state to get parks from all counties on the database. So we're not quite ready for other counties to be on there yet, but we want to soon. You are also invited to follow Park RX Utah on Twitter and Instagram for updates and information on this initiative. We will also be hosting a photo contest for Park RX Day this month for all Utahns to participate in, especially in lieu of the COVID-19 pandemic, which you can share with your patients. If you are interested in being a prescriber for Park RX or to be a part of the coalition, please email parkrxutah@gmail.com, or you can email me at skinnison@slco.org. Thank you.
Thank you, Sarah. That's a lot of really good information. So if you have questions for Sarah, please put them in the Q&A portion at the bottom of your screen, and we'll get to those at the end of our session today. All right, Dr. Spencer, do you want to do any slides? Do you want me to stop sharing?
No, I mean,
okay.
We'll keep this pretty cash.
We're good. Okay.
I'll share my screen maybe in a minute, but for now you can. This is maybe not as visually exciting as some of those other things. So thank you, and thank you for the opportunity to let me speak today. Thank you for the opportunity to be here. Thanks for doing this virtually. This is so fun. We've been doing a lot of things virtually lately, and it's fun to do something that is not COVID related. So I'm really excited, and I'm sure, you know, that'll probably come up, but this is like the best thing that's happened in a couple of weeks, to get together as this group and talk about some of this rural health things, and particularly excited to be a part of this conversation. And again, thanks for letting me be a part. I do have to tell Sarah Kay that I already signed up. My account has been confirmed, even though it sounds like I maybe shouldn't have done that. So I'll have to email you and delete it or something. So I'm excited to hear about these things. I've taken several pictures, you know, of the slides, just like I would at a normal conference. I thought Sarah H, that was great, and some good data there that I'm going to share with my partners and my colleagues and my patients. So I was asked to speak briefly on the Walk with the Doc program. So again, my name is Jesse Spencer. I'm a family medicine physician in Richfield, Utah. I actually grew up in Salt Lake and saw the light, you know, and decided to move to a rural community after finishing my training program. And part of the reason I did that was for scope of practice. I enjoy doing, you know, emergency department and obstetrics and inpatient medicine. And but the other part really truly was I felt like I'd be better able to kind of have this sense of community, you know, this feeling of making a difference in the community. And I've been here in Richfield for about 9 years this summer, and you know, can't imagine ever moving back. I do like going back to Salt Lake and some other places to eat good food occasionally and do some other things, but it's always refreshing to come back to Richfield. And a couple of years ago, you know, as part of, I mean, medicine hits you in the face, right? And you get, as a physician, I don't know if this happens to everybody, but I think it's relatively common, where you might sit back and kind of look at your life and say, am I really happy? And am I doing the things that I wanted to do? And you get super busy in practice, that sacred time where you're able to reflect on what it is that really matters, and am I making a difference? I think, you know, kind of a couple of years ago, it's like I got so busy and super crazy, and I took a step back and I thought, is this really meaningful to me to go to clinic and see, you know, 20 something people, and then at the end of the day, sit back and say, what did I do for these people? I filled a lot of prescriptions, and I did a lot of rushing through appointments, and I think I did a lot of charting and some other things. And I came to maybe a little bit of a realization that I kind of wanted to get out of the clinic, right? And have some more connections with people outside of the clinic. And those were the more meaningful things as I thought about my residency program and about my, just in medical school. I thought, man, I was doing a lot more in my training programs outside of clinic than I am now as a physician. And those were some of the things that drew me to medicine. About the same time as that was happening, Intermountain Healthcare, I'm an employed physician with Intermountain Healthcare, started kind of pushing the Walk with the Doc program. And I don't think it was a huge push. I think I maybe received an email or two, and a friend of mine who's an operator in the Provo area was pretty psyched about this, and said, hey, Jesse, you know, maybe you ought to look at it. And so we did. We signed up to be a part of the Walk with the Doc program, and we've really enjoyed it. And so over the past year or so, we've been part of the Walk with the Doc program. We're an official chapter. Walk with the Doc is a national organization. It was started, I think, in 2005 or something like that, 2008 maybe, by a cardiologist who sat back, you know, probably like I did in his clinic, and said, you know, I'm kind of frustrated with the ability to, or the inability to affect patient behavior the way that he wanted to, right? I mean, it felt like maybe doing prescriptions and then hasta luego, and then they come back in 3 months, and the meaningful things, the connection with people, the connection with outdoors, and the exercise weren't happening. So we started this, and it's grown. I think it's in, you know, multiple countries, most of all the states. I am going to see if I can share my screen. Let's see. I'm not super savvy. We'll see. You guys see it? Not seeing it. Can you see a screen?
Yeah, now we can. Yes.
Yeah. So this is my account was confirmed on ParkRx. So, you know, so I would refer you to the walkwiththedoc.org webpage. It's super simple, super easy. And it, you know, kind of goes over their mission, their metric, you know, who they are. There's some data and some things in there. What I like is this kind of interactive map in the middle of their homepage. And if you zoom on it, you can find where there's Walk with the Doc chapters. You can see we've got a few in Utah, a few in the Salt Lake area, Provo, Mount Pleasant. That's my friends in Mount Pleasant. Fillmore has one. I'm not sure about Delta. I thought they had one. But so a couple of our rural areas within Intermountain have them. I think St. George has one. And you can push on, you know, the Richfield one. You see my name there. I'm not sure why I'm the only person that has a name there, but and then follow the links to read more. And you can kind of see pictures from our walks. This was one of our walks last year. And this was probably also last year. That's me and my daughter. So these are things, you know, so in signing up with a national program like this, there is a cost associated with that, but you end up getting some swag, right? So we have we got some t-shirts and we got some pedometers. They give you a lot of ideas on how to advertise the program, how to organize it, and then they give you access to this web page. We have our own Facebook page, and of course on the right side of the page we have some contact information. This is typically we've been walking every third Saturday of the month. We meet at 10 and it usually lasts about an hour. We've been walking in the same location at just one of our parks here in town. And then a couple other links to, you know, your website links and things. So basically how it started was we chose a champion and I, you know, took it up. I was the champion in the clinic. I'm not the only physician in the clinic who does this. I have a group of 7 or 8 partners who we take turns. We kind of split it up, you know, taking turns each month. And what the program is that we get together at the park. It starts at 10. There's usually a group from, we've had as many as 40 people to, you know, some days we'll only have like 5 to 10 people depending on the weather. But, you know, usually we have around 20 people. We get together and the provider, whoever's in charge that day, gives about a 5-minute message, right? Just a 5-minute, anything of what's on their mind about health. It might be about exercise. One of my favorite ones was about my partner talked about sleep and, you know, shared some anecdotes about his own sleep and his sleepwalking and all sorts of things and maybe some marital problems. But, you know, so anyway, it was really funny and kind of not really marital problems. But so we share a quick message, 5 minutes or so, and then we take off from the park. And in Richfield, we're lucky enough to have a little pedestrian trail that we have a route, and we just walk to some ball fields, walk around the ball fields. We snap a picture. That's kind of our tradition. And then we head back to the park. Usually somebody from the clinic has picked up some apples, some bananas, maybe some bottled waters or something like that. And it's super, super simple, super easy. The way that we advertise it is mostly in the clinic. We hand out flyers. We have every Friday. So today I didn't wear it. I'm kind of embarrassed, but every Friday we wear our Walk with the Doc shirts. The staff gets to wear their Walk with the Doc shirts and they enjoy that. It's kind of their casual day. We have flyers and we hang up things in the rooms. In small towns, we have the advantage of like people still read newspapers, like the local newspaper. And, you know, when we started it was like, I think it was like on the front page of the Richfield Reaper, right? And so we got some steam that way. We're in the bulletin in the paper, and we also have, you know, radio shows in small towns. You know, our little local radio station we can advertise on. The biggest thing that we've done though is social media advertising. That's probably, you know, where people are seeing it the most is we'll just advertise, you know, the week before the week of our walk, we'll put a few reminders in there, and that's how people are showing up. I'll tell you that a lot of the people that show up are actually people from the clinic and, workers from the clinic, which is nice. You see people, the MAs and the secretaries and the docs, the PAs, everybody, brings their families out, and it's nice to get together outside of the clinic for that reason, or for the reason of, you don't get to usually see these people in their family environments, and it's nice to get to know them a little bit more. And so about half of the people are that come out usually are from the clinic or the hospital. Our clinic happens to be associated with the hospital, so I've been working with the hospital to get more and more of them out. And then the other half are just patients, people in the community, not even necessarily patients, my patients, right? They're patients that, or they're just community members. And that's really the four big benefits, I think, of Walk with a Doc are, you're able to reinforce the health benefits of exercise, which is super important everywhere and super important in rural communities where, generally our health isn't quite as good, and there's just not as many resources for physical activity and gathering. Two, you get a little blurb of health education, right? It's an opportunity for us to make connections with patients and make connections with the community about whatever's on our mind that day. Three, and this is a little tricky in the COVID times, but being with others and building that sense of community, I think has been fun. We had one of our first, I guess maybe our first couple of walks, we were lucky to have some people that I had never met before. And the walkers start talking to the other walkers, and after they've been out there a couple of times, they get to know each other. I've been able to bond with this family that has several kids, and we every week they come out and tell me some new knock jokes that they've made up that are not as terrible as the knock jokes that I make up for them, and we're able to share that. We've had some of the walkers have been able to, because we're just doing it once a month right now. But some of the walkers are getting together on the other Saturdays, and there's actually a study, I think it was the University of Colorado or something, and they found that about 40% of their walkers were actually that community that was built. They took that outside of.
I think we've lost Dr. Spencer. He's frozen in midair. Can you hear me?
We've really had a good time with I'm going to stop sharing. I just realized you've just been looking probably at not a lot, but we've really had a good time in our community with it. It's been a super fun thing for our clinic. Everybody has been highly engaged, from the providers. Just everybody, all the caregivers in the clinic have been highly engaged, and it's fun. It's really, really fun to do. We've talked about, it's fun. We talk about doing other things. We talk about putting together one that's maybe specifically for the youth, maybe the high school kids, and doing it on an after class one of these days. We've talked about doing a kindergarten prep discussion and then walking with the kindergartners. We actually had some plans to do a Easter egg hunt along our walk, but that's not happening. So you can get creative with it. The nice thing about the program is that it's so simple and so reproducible. It's so easy to do. It works. It's fun. It engages our caregivers, our community members, and we really enjoyed it. So I'm curious to hear any questions, maybe some feedback.
Yeah, thank you. That's really interesting. I have one clarifying question. You said there's a cost associated. Is that cost for the clinic offering it, not for the participants?
Exactly. Yes. Thank you. Yeah. The cost, it's free for the community. The cost is to basically use the brand of the Walk with the Doc, to use their resources.
Okay. Great.
Upfront cost. We were, being an employed provider, Intermountain, of course, covered that. It's not an outrageous cost. It's not anything that, you could come up with creative ways to even fundraise for these kinds of things. But we were lucky enough that Intermountain covered it for us as part of their Live Well.
Yeah, that's great. And then you get all of the brand and the resources of the website and all of that information.
We were able to get some pedometers and some T-shirts. So I think the first 50 people that signed up with us, that signed up to go on a walk. They, we gave them t-shirts or pedometers. By the way, I do think that some of that fee, there's actually an insurance coverage as well. That walk with a doc. You don't want anybody to fall, but there is some liability coverage with that nominal fee, is what my manager was telling me. I asked her about that last week.
And regarding that, Dr. Spencer, we have a question from an attendee that's kind of right up that alley of how do you handle HIPAA restrictions while on walks with groups, and do they have to sign releases?
They do have to sign a release. So there's a sign in that you have to sign in when you get there. So we have everybody sign in every time. That also, by the way, serves as a way that we, like an email list that we email things out to. And we don't typically share any HIPAA. There's not been any HIPAA issues. It's not like an organized, medical treatment or something, so I think sharing the pictures after they sign the release and again, that small bit of liability that I think there is with the Walk with the Doc organization.
Great. And that voice from above was Danielle. She's monitoring our questions for us. So your face doesn't pop up, so it's just kind of this voice from the sky. So I've seen a couple questions in the question box and about how can we help people. How are these programs happening now, if they are, while we're being distanced from each other? And second, kind of related to that, one of the benefits you both talked about was getting out and connecting with other people. That's part of the benefit of this type of program, even if it's just you're walking alone, but there's other people out and about. But how do you manage that during this time? And if this goes on into the summer, how can you continue to promote people being out walking, but still maintaining that social distancing in the way that they are supposed to?
So I can take that with the Walk with the Doc. So they've, of course, kind of as a bigger organization, they've addressed this on their website. When you first pull it up, I think there's pictures of families walking with, they're 6 feet apart, people walking with they're 6 feet apart. And so that's still something that's, that you can do. Even that, though, with certain areas, I know is restricted. In rural Utah, at least right now, we're not as restricted as, we don't have the stay home kind of things. There are virtual walks, and that's something that my clinic manager and I, who, by the way, my clinic manager is the other champion for Walk with the Doc in my clinic. I think it's important to have somebody outside of the physician or, provider. But so she and I talked about doing our own kind of virtual Walk with the Doc where you can, hashtag things. I'm not super savvy, but hashtag the Walk with the Doc virtually. It obviously is much more difficult. One of the things that the National Walk with the Doc recommends is when you're going out for a walk to FaceTime or call somebody, obviously being careful with being safe in doing so. And that's one of the things that they've said, use that time as out on a walk to make a phone call to one of your loved ones. It's tough. I mean, I think it's really tough. I do think in rural communities, we are a little more, we're able to do that a little better. I think there's more opportunities there's more open space, right? So there's a lot more open space and areas to go to that you can still go for a walk and get away from people like very, very easily. I'm looking out my window right now and there's plenty of trails and spaces right outside my window that I could hit up. So I think you got to be creative about doing some virtual things, some virtual check-ins. We've talked about reaching out to our email list and just calling them and checking in, seeing how they're doing. That's the nice thing about having a list is that you've got this little community that you've built, and we can do some things like that.
Yeah, great. Sarah, any thoughts on that?
Yeah, just kind of going along the same lines. You have to be creative. Parks are still open, at least in Salt Lake County. They're still open. You can't use the playground. You can't do any close contact sports, but you could still walk around. Or I even encourage people to walk around their neighborhood, even if it's just like a 10-minute walk. something is better than nothing, because a lot of people are really stressed and have a lot of anxiety because of this outbreak, and just being outside and being active in whatever way you can. Obviously, if you're compromised, don't do that. But as long as you're following the social distancing protocols, you should be good. Yeah, and for this, kind of reiterate, our photo contest starting April 20th. And that's kind of encouraging people to share what they're doing outside while respecting those social distancing protocols. And we even health department came up with like an I Spy flyer that we're going to share as well for kids to participate in. It's like talking about I spy 5 birds or 10 rocks or something. So it kind of gives them an activity. So it's just the same lines, just be creative during this time.
Yeah, I think we all are having to learn how to be a little more creative and a little more computer savvy. Those are the things that I'm learning, at least. I'm curious, Sarah, you mentioned in your presentation a little bit about partnership and collaboration. Can you maybe share a little bit more about how that has helped your program to be successful? And I know you're still in the beginning phases of trying to implement ParkRx and move a little bit beyond Salt Lake County, but how are partnerships essential to that? And are there, particular types of partnerships you would look for, and maybe especially thinking about rural areas, how that might be essential?
Right. When I was preparing for this, I actually had this idea. We're talking about for our ParkRx Utah Coalition to have work groups. And so potentially in the future, we would love to have a rural Utah work group that would take on the specific needs that rural Utah has. And what we look for is just all those partnerships that I talked about before, is public health, healthcare industry, insurance. We're still trying to get into the insurance world. They have a huge voice. Like you talked about, Sarah, in your slides, that you can see them as a source for their health, and as well as the outdoor rec people, Parks and Rec, and just the different expertise. They play such a big part in this one effort. Even just hearing the different programs that are out there, like Walk in the Dock, like I got a lot of great ideas from that, and it's great to hear the successes that a program like that is having. And there's just so many things that in my one public health set of mind, I can't have these different ideas. And so it's been very beneficial to have those resources at hand.
And this is Danielle again. We have an attendee who, it's kind of along the same path of, did you mention any working with fees for state and national parks, even though we may be going through this COVID situation, but do you have anything up in Salt Lake or anything to add on that?
Sure. Obviously, especially in the rural Utah areas, they have more access to state parks and national parks. We want to work with the National Parks Association to see if we could create some partnership with them to see if they would limit those fees. That is a barrier, obviously, for the national and state parks. So that's kind of the next hurdle, is figuring that. So right now we're pushing for the local parks and the free hiking trails that are in the area.
Great. I saw another question in the Q&A section that says, schools requiring physical activity is very influential in the youth, but it can also make exercise feel like a task. And this is sort of outside of these two particular programs. But what sort of things can be done to make exercise fun while it's also mandatory in both youth and adults? I think that, a question for all of us. If it feels like this is a must-do task, it's harder to do. But if it feels like something that we enjoy doing, that makes it a little easier. So your thoughts for kids and adults to make it something that is appealing to be active. Any thoughts, Dr. Spencer?
Not sure if you're hearing these echoes. You okay? No. All right. So yeah, I mean, I think you can make exercise fun for adults and for kids. Again, I think with COVID restrictions, you have to be a little careful and you have to be a little creative. But assuming this all gets over, and we can all take a moment of silence here, but assuming this all gets over soon, the social thing has been, at least with the Walk with the Doc program, has been really fun, right? I mean, I talked about that little family that I've been doing knock knock jokes with, and I mean that's really happening. We make it fun. We talk with these kids. We get to know them. I introduce them to my kids who come on every walk with us. And I think the socialization that happens during exercise can be fun. I think we've talked again about doing some things in the walks, like little treasure hunts or some things like that might keep the interest for some of the kids. And honestly, with the adults, some of the people that we've had come out, it's the first time I've seen them in the community, right? Like I don't see, and I feel, in small towns, you feel like you kind of see everybody, but it's the first time I've seen them in the community, and just socializing with them, I think has been a big deal. And then, I mean, we do the little treat thing, which is kind of fun, and we meet at the park, which I think has made it kind of fun, but mostly I think it's the social aspect for our exercise. And I think of that even in my own life, and my wife's life, her little run group right now is like the most active little text group that there is, right? I mean, they're always texting each other back and forth. Even though my wife despises running, this has been fun for her to have somebody to check in with and somebody to share success and trials, barriers with. So.
Yeah, and it'll be interesting to see if, once we're through all of this, if people are even more desperate for that social connection and maybe more interested in participating in these types of programs, because they have, been isolated or distant for this period of time, and it will help to get out and be outside and be with other people again. That might boost our programs in the beginning, maybe.
We're all recognizing how social humans are, right? Like, when it goes away, we're recognizing how social of beings we are. So I think, there's some silver lining maybe.
Yeah. Sarah, any thoughts to add on, and maybe particular for youth and other things the health department's working on?
Yeah, so one thing that came to my mind just to start with this is that it's all about finding the right activity too. Like, I'm not a runner, so I do not find joy in running. But there's other activities like tennis and things like that. If we're just talking about being physically active in general, just providing those opportunities for kids, especially to be active and finding their niche, what they are passionate about. And I do agree with the social connectedness. There's so much benefit participating with others in the same activity. Thinking about the health department, I can't really think of anything right now that we're doing. I know that we have a program that's called Rec Box. I don't know if that's something that clinics can participate in, but we have something where we rent out recess equipment to our elementary schools. Obviously, schools are closed right now, but that's something that we provide to the teachers for like a rainy day or a bad air day. And so that's potentially just those fun little, there's jump ropes, hula hoops, just little things that we provide for the community.
Great, thank you. I'm looking at another question that came in that says, what are your thoughts on conference calls during walks? I'm not sure if that is specifically asking about, work conference calls. I know that there's some worksite wellness policies that will include things like walking meetings. I think the health departments do that oftentimes, so that, if you're normally would be sitting around a conference table, you might do that out on a walk if there's a good place near your office. And maybe taking conference calls while you're out on a walk. But any specific thoughts on conference calls during walks?
I mean, I can talk to that a little bit. I have loved conference calls at work while outside and taking walks. I think it's helped keep my sanity, right? It's tough to keep focus like when you're in your office or in your home all day on a video. So I think it's absolutely fine to go for walks. And I have this little thing. I do not have any stock in this company. This is like a speaker that you put on your shoulders, and so I use this when I go for walks because I can still kind of hear what's going around outside, but also this projects really nicely, and so I don't feel like I got earbuds in and like ignoring the world around me and for safety concerns. So it's been nice. And there's things like that, you know, that you can do to make walking during phone calls a lot easier and a lot more, I guess, valuable.
Yeah, great, and safe too. Danielle or Locke, any other questions that have come in that I've missed?
Yes, so there is one that just came in. It says, how can I recommend my doctor for these programs? I would love to have this in my community. So I'm assuming with the walk with a doctor, but I mean, just what are your thoughts on that?
So I think, again, I think that a lot of us providers are starving to do things outside of clinic, to connect with our communities. It feels like sometime in clinic has become like an administrative thing, right? Like it's check boxes, it's EMRs, and that speaks to me. You know, Walk with the Doc speaks to me because it's refreshing to connect with the community outside of clinic in a different way, and you know, not have to write a note about it or whatever. And so that's really the message that appealed to me, and it does do good, right? Like when it comes down to it with healthcare, what is good for you? Well, it's exercise and it's connection, right? Those are the things that are like super important. And so that's the message that sold me on the idea. And it basically took a regional champion. I mean, my friend in Provo who worked for Intermountain, saw this as an opportunity and just reached out to me. So, you know, I think if there's the other selling point is it's super easy. It is so easy to do. And it is important to get the buy-in by other providers, if there are other providers in the community, but it is so easy to administrate. There's not a lot of paperwork. There's that little upfront application, but otherwise it's, you know, somebody makes a flyer. And my guess is that if you can make it as easy as possible, so say you have a doc in your office or in your community and you volunteer to help administrate these things, that would be helpful.
And I think Sarah Kinnison, talk about how we can get more doctors writing prescriptions.
Yeah, no, that's one of our hardest things. Just with getting pilot programs is getting people that buy-in. So Jesse, it was completely okay that you signed up as a prescriber. The proactiveness is great. So it's just that we want to make sure we're doing this the right way, that we're just getting certain data from you guys. So yeah, we're trying to hit those major healthcare systems like Intermountain, University of Utah, to make this a part of all of their EHRs, that it's part of their practice. But we also want to hit those independent clinics as well. And so for right now, I think if someone's interested, or if you know a doctor that's interested, I think the best way right now is to email that parkrxutah@gmail.com or me I can send out more information. It's just, I just need to send the information about the evaluation measures that we're looking for. But like Jesse did it during the presentation, it's super easy to sign up as a prescriber. And just as getting more champions and more people to talk about how easy this program is, I think that's how we're going to get more prescribers on this.
And Sarah, this is Locke again. I'd really challenge us those large systems are a great place to start, but we have 9 independent hospitals and a number of independents throughout that we always need to remember throughout Utah.
Yeah, no, we want everybody to be a part of this. And it's actually what we find, it's easier to actually work with those independent hospitals and those independent clinics because there's not as many loopholes to go through. And so we are very open to working with that. And there's a clinic, for instance, in Richfield, we could start specifically targeting that database with the parks in the area, so we can honestly get those park prescriptions like within the next month or so.
I think, yeah, a lot of times, like you both mentioned, it takes a champion in that community, whether it's a champion within the clinic or in the community who wants those programs to get up and running. And so, on this webinar today, there's nearly 100 people. I'm sure there are some champions on right now who could help to get this started in their community. And so in just a second, I'll show you a slide that has everyone's email address. Well, I'll just do it now. Email addresses, and you can reach out, that to get more questions answered or to speak up as a champion in your own community. There was one last question I didn't want to forget. Can the doctor tell us more about the headphones he uses and puts on his shoulders? So maybe you should have stock in this company, because it sounds like there's some people interested. If you want to give another plug for those.
They I just got them on Amazon. I think there's a few different brands that have a mic and a speaker, a Bluetooth speaker that hooks up to your phone. They sold, this particular brand is Bose, and they sold terribly, like it was a failed project. So they went on sale. I just looked it up. They're expensive, but there was a time when they were on sale for like really a lot cheaper than they are now. So maybe they're trying to have a comeback or something. I don't know. Because it was kind of a failed project. I don't even know if they're making them anymore, but I just got them on Amazon.
Yeah, maybe watch for sales on that. So again, there's a lot of people on the call, and hopefully some of you in your own communities can see ways that you could implement or be a champion to implement either a ParkerX program or a Walk with the Doc type program. And I think these are both examples of ways that we can address some of those barriers that I mentioned in the beginning of people feeling like they don't have, again, this is outside of our current situation, but in their normal life, feeling like they don't have time or energy to be physically active. And so when we can make those experiences that they can walk with their family, so that's family time as well, when it's in their own neighborhood, when it's something that's easy and convenient for them to do, I think that helps improve the availability of being able to be active and helps to get Utahns up and moving and out in the outdoors and getting the benefits of being connected to people around them as well as to their environment. So I again want to just thank any last thoughts or questions before we wrap up? Yeah.
Can I just jump in real quick? We had a great thing come in the chat here from USU Extension Health and Wellness Team, saying they're interested in signing up as a prescriber to promote physical activity out in the communities. I think it's important to know that physicians don't need to be the only ones prescribing this, that lots of us can. Maybe we could just make a quick comment in that area, and let's get USU Extension signed up so that we can promote this in every county.
Yeah, Sarah, will you talk a little more just very briefly about the other partners that you've tried to get involved other than physicians, providers?
Right. Yeah. So it doesn't just have to be a healthcare provider or a nurse or someone with a medical license. We actually have seen a lot of interest in our worksite wellness programs around the county. And so whatever it could be, we would love to work with USU Extension. They just sign up as same as a provider, and yeah, you don't need to have a medical license to be a prescriber.
Great. Other final thoughts, Locke, that you want to make sure we cover?
Just want to thank the panel. Thank you very much.
Okay, yeah, so thanks again to Sarah and Jesse, who I know are both extremely busy. It is nice to take a little bit of a break and talk about some really positive, I think, and promising programs that are happening throughout the state, including in rural areas. And again, if you want more information, there's all of the email addresses there. Please reach out to get more information. And thanks for your time. Thanks, Sarah. Thanks, Jesse.
Thank you.
And yeah, feel free to reach out. I'd be happy to help with Walk with the Doc or anything else. I'm always curious if people have better ideas too. So give me your ideas, because I think we can. This is a good venue to get together, I think, and just thank Locke real quick. To get people together and talk about what we can do in these communities. So thank you.
Great. Thanks, everyone.
Thank you.